Hello, everyone. Welcome to today's webinar. My name is Courtney Malberg. I am the Associate Director of Education here at CurePSP. Stick around at the end of the conversation today to hear how you can help spread awareness of PSP, CBD, and MSA. However, today you're in for a treat. Today's Ask the Expert webinar is your role in advancing legislation through advocacy. Before I introduce our speakers, I want to first share a few housekeeping items. First, this program will be about an hour long, including the presentation and a question and answer session afterwards. 2, we're recording this webinar live, but it will be archived on our Facebook and our YouTube channel for viewing later. 3, if you have registered for this webinar, you'll receive an email with today's slides. And if you're watching this live, the slides will be dropped in the chat. We will be answering relevant questions submitted in the registration, but please feel free to type any questions into the chat as the presentations are going. We will try to answer as many as we can during the Q&A portion. And lastly, please use the chat box to tell us where you're tuning in from. To introduce our first speaker, first up we have Mason Ziegler, the Government Relations Officer at the Michael J. Fox Foundation for Parkinson's Research. He leads the federal lobbying efforts for access to care policy priorities and the National Plan to End Parkinson's Act. Thanks, Mason.
There we go. Thank you for the introduction, Courtney, and hello, everyone. My name is Mason Ziegler, and I lobby for the Michael J. Fox Foundation for Parkinson's Research. I want to start by saying thank you for taking time out of your day to listen to my presentation on how you can advance legislation through advocacy. You may have heard of the organization I work for, but to cover our bases, the Michael J. Fox Foundation for Parkinson's Research is dedicated to finding a cure for Parkinson's disease through an aggressively funded research agenda and to ensuring the development of improved therapies for those living with Parkinson's today. The organization was founded in 2000 by Michael J. Fox, and to date, it's funded more than $2 billion in Parkinson's research around the globe and supported more than 3,200 projects by academics, biotech, and pharma. So we mean it when we say that we are here until Parkinson's isn't. I work within the public policy department at the foundation, and the purpose of the team that I work on is to advance legislation. And we are successful because we work alongside a nationwide network of advocates. Specifically, we advance bills at the state and federal levels to improve the quality of life of people living with Parkinson's disease, prevent folks from developing Parkinson's by reducing exposures to known and suspected environmental risk factors, and maximize investments made by governments in research to prevent and cure Parkinson's. Before I jump into my presentation, let me please clarify that when I refer to Parkinson's, I am typically referring to a number of diseases that include both what we consider Parkinson's disease and atypical Parkinsonisms, including progressive supranuclear palsy. Honestly, I am honored to have the privilege of sharing a little bit about what I do and how we work alongside CurePSP and other nonprofits focused on ending Parkinson's and Parkinsonisms. And our legislative work exemplifies our commitment to better understanding each of these diseases and improving the lives of those who they impact. So thank you again for having me. The game plan for today is I will share some information, and later you'll have the opportunity to ask some questions, which I'm looking forward to. The best part of my job is getting to answer questions for folks. So as I go through my slides, please jot down the questions that come to mind. Also, I'm going to focus a lot on a bill called the National Plan to End Parkinson's Act, which if you already know about, awesome. And if this is the first time you've heard about it, I am so happy to get to be the person to tell you about it. I'm going to use that bill as an example to explain specific ways we are working with folks just like you to advance legislation that will help us end these diseases much more quickly. So, really quick, lobbyists are akin to salespeople in a way. Our job is to sell members of Congress and their staff on bills, so please forgive me by starting by bragging about some of the great work we do at CurePSP and the Fox Foundation before I talk about what it is we do. But as a baseline, we try to connect members of Congress and their staff with constituents who have been impacted by Parkinson's and PSP. Your members of Congress want to know about the priority issues for their constituents, also known as voters, so they can best represent you and your interests on Capitol Hill. Obviously, members of Congress do this to varying degrees, but what is clear is that when we raise our voices together, Congress listens. I think this slide presents a nice snapshot of what we consider to be our metrics of success. We care deeply that we complete our work in tandem with members of the communities we serve. And last year, we completed more than 350 congressional meetings with over 850 advocates, which is significant. We focus on getting folks like yourselves to connect with your elected officials for a number of reasons, not the least of which being that you are the best folks suited to talk about how PSP impacts your lives or your loved ones. We also do it because it works. Congress and members of their staff pay far more attention to priorities when their constituents join us. Your passion, commitment, involvement, stories, relationships, follow-up, and thank yous, they're all useful. And my job is focused on how we can work together to move policy forward and do it quickly. In 2023, you'll see that our state team has been on a roll. They've been working in the halls, in offices, and hearing rooms of state legislatures across the country. And they're speaking with state legislators to testify on behalf of bills and meet with advocates. At the federal level, we also have found some success in the first half of this congressional session, with the National Plan to End Parkinson's Act passing out of the House of Representatives, and the Environmental Protection Agency, or EPA, proposing a full ban on trichloroethylene, or TCE, which is a chemical known to increase the risk of developing Parkinson's. Passing any legislation in either chamber of the current Congress is a feat. I mean, they are sometimes failing to deliver even the basics, like funding the federal government. Yet, we work with our champions on Capitol Hill and advocates across the country to pass a bill in the House in a bipartisan fashion, with nearly every member of the House voting in its favor. Again, I'll harp more on this in a moment and further explain that bill and why it's important. But first, I want to explain the Unified Parkinson's Advocacy Council. This is actually how I've gotten connected with CurePSP. The foundation created the Unified Parkinson's Advocacy Council, or UPAC, some years back, and it's comprised of representatives from local, state, regional, and national Parkinson's organizations, each of which are listed on this slide. UPAC members gather information on the priorities of people living with Parkinson's and their families, hoping to ensure that the needs of the broader Parkinson's community are represented in our collective policy efforts. We work together on letters to policymakers when relevant bills or federal rules are being debated, and share ways for Parkinson's constituencies across the country to advocate. As part of my job, I serve as the federal team's liaison with this group. So I've worked with Jessica and Julie, who you'll hear from later, as they've pulled together some really fantastic advocacy resources for the PSP community. They've made it so simple for you to connect with your members of Congress and talk specifically about how PSP impacts your life and why federal policy is imperative to preventing and curing the disease. So you may have heard that closed mouths don't get fed, or if you're not at the table, you're on the menu. You can pick your analogy, but the bottom line is we advocate so Congress prioritizes the needs of our community. We work for a number of reasons, but our work really seeks to advance prevention and cures. Through our work, we raise awareness of Parkinson's, increase and diversify research funding for the disease, advance tests, therapies, and treatments that will improve the quality of life of people living with Parkinson's and Parkinsonisms, improve access to those tests, therapies, and treatments for folks, and reduce exposures to known environmental risk factors to prevent more folks from developing these diseases. The reasons behind why we advocate are pretty straightforward. If you were to put this list of objectives in front of members of Congress, they would likely have a harder time saying no to them than yes, right? Well, that's the key. It has to be put in front of them. And that's where you and I come in. So I'm going to take some time to explain just how we do that. Now, this slide looks a lot like the first, looks like a lot at first, but I'm going to break it into 3 bite-sized pieces going from left to right. When we talk about who we engage in policy work, this is our short list of the types of stakeholders who are critical to moving legislation forward. We have folks like yourselves who are members of the community, care partners and family, and supporters. And we also have elected officials and thought leaders who are the obvious pieces of the puzzle. However, we also incorporate corporate partners, many of whom have public policy departments themselves and are very involved in what happens on Capitol Hill, as well as healthcare providers and researchers. We involve each of these groups in different ways, and I will focus specifically on how you can join us in this work in a moment. But I want to paint the broader picture with you. You and your stories are an essential element of how we can move legislation forward. In the middle, I've highlighted the broad categories of how we involve the audiences I just covered in moving bills forward. We organize, such as through UPAC and coalitions in Washington, D.C. We conduct outreach, including emails, phone calls, virtual meetings, and in-person meetings. And these are no small feat. However, I want to focus on relationship building and grassroots engagement. These are my main focus as a lobbyist. My role is to move bills forward And one of the most effective ways to accomplish that is by helping our best spokespeople, yourselves, develop relationships with the folks who represent you as well as their staff. And I want to quickly note that we do this regardless of your members of Congress's political affiliation. So yes, sometimes my job is the absolute worst version of Match.com, because you may not align politically with your members of Congress, but we still need their buy-in and support for our policies. And we do all of this to accomplish key results listed on the right. It's about raising awareness, educating lawmakers, challenging perceptions, displaying support, building relationships, and leveraging our role as subject matter experts on Parkinson's and PSP to advance bills important to our communities. And then on this slide, you can see the key results are replicated on the right, but now we're focused on you, specifically how you can advocate with us. Most notably, you can share your story by calling and emailing your legislators. These folks also often host town halls and listening sessions in the districts and states they represent, and you can use those events to speak with them about how PSP has impacted you or your loved ones. You might also share your story through media, like op-eds, letters to the editor, and blogs, or take directly to social media. You can also build relationships with members of Congress and their staff. We hope folks accomplish this by creating ways for them to share their experiences with policymakers. But you may also simply have them engage with you and other members of the community. Last summer, I helped a UPAC member, the Houston Area Parkinson Society, host an in-person boxing event with their member of Congress, Representative Fletcher. It was in Houston, and it was in the summer. So even if you weren't boxing, you were at least getting a good sweat in. But it's a great example of how you can work with members of Congress who are already your supporters by helping them connect with the community. You might also participate in digital advocacy, which can entail participating in action alerts, emails, surveys, and petitions. And these are often made available by organizations like CurePSP and the Fox Foundation, and I'll share more information on that in a moment. But as an example of how these are helpful, I want to explain what happens from our end when you participate. So when you participate, say, in an action alert, which is an online campaign, you share some of your information to ensure that you're messaging the right legislators. You edit the message to include your personal story, or sometimes you can just hit send. And then most often you get a nice confirmation email from either our team or sometimes your members of Congress. However, you also signal to us that you care enough about an issue or priority to take a few minutes out of your day to send a message. Whenever our team schedules meetings with members of Congress and their staff, we look to see who from those specific districts and states have taken action on behalf of a priority we're meeting with them about. And then we reach out to those folks to see if they'd like to be trained and participate in our meeting. You then have the opportunity to meet with the staff or the elected official themselves to introduce yourself and explain why they should prioritize policy for people living with PSP. So one small or insignificant action, such as sending an email to your member of Congress, can be part of what leads you to being more prepared and involved with helping move important policy forward. This is the basis of grassroots advocacy. Our democracy, at least in theory, works such that members of Congress and their staff learn from and represent the interests of their constituents. Our job is to help make sure that happens, specifically to end Parkinson's. At a high level, I've covered what advocacy is and how you can get involved, but now I'm going to shift to talking about specific policies we are advancing at the federal level and about how these bills will help our community. So on this slide, you can see that we take a divide and conquer approach when it comes to direct lobbying in Washington, D.C. This slide covers 3 of our federal policy portfolios, which include research funding, access to care, and long-term care. And we also have a portfolio focused on environmental risk factors, which I'll speak a little bit more about at the end of my presentation. But we lobby the federal government to invest in Parkinson's research at the NIH, the CDC, the Department of Defense, Department of Veterans Affairs. We all know that investments in research, including financial support from the federal government, gets us that much closer to a cure. Congress was pretty rough and tumble when it comes to appropriations this past year, and we expect the same for this year. Many federal budgets were cut and will continue to be. That's expected. But sustaining federal funding is considered a welcome outcome, and any increases in federal funding for PD research is great. And I'm happy to share that the most recent fiscal year turned out great for several programs focused on Parkinson's. Specifically, we helped secure an additional $4.2 million for Parkinson's care and research at the Department of Veterans Affairs. We know this is important given that veterans are disproportionately represented within the Parkinson's community, and we're laying the groundwork for increasing sources of funding in the federal government for Parkinson's disease research across the board. We also work on access to care issues. This is where we engage, for example, on issues related to Medicare, because 90% of those who are living with Parkinson's in the United States rely on Medicare for their health coverage. We dig into important issues like advocating for drug affordability and better access to providers, such as through telehealth, as well as treatments and tools for diagnosis. We also focus on long-term care, and these issues tend to relate to nursing home care or community-based care services, as well as policies impacting care partners and caregivers. I don't want to belabor the specifics of these portfolios at the moment, but if you're interested in learning more or getting involved in advocacy on behalf of these topics, please let me know. Now that I've covered some of the topics that the Foundation's Public Policy Department focuses on, I want to take you into a deep dive into legislation that I mentioned earlier, that National Plan to End Parkinson's Act, and how we're working alongside CurePSP to pass this bill this session. So the National Plan to End Parkinson's Act, if you haven't heard about it, is first federal legislation solely dedicated to treating, preventing, and curing Parkinson's. Before I go further, I want to explain that despite its name, this bill defines Parkinson's, and I'm quoting from the bill text here, as Parkinson's disease and all other neurodegenerative Parkinsonisms, including multiple system atrophy, corticobasal degeneration, progressive supranuclear palsy, and Parkinson's-related dementia. It's modeled after the National Alzheimer's Project Act, and this bill is no-cost, bipartisan legislation that would establish an advisory council tasked with creating and implementing a national plan to end Parkinson's. This legislation is about getting all the right folks around the same table to chart a path forward for Congress to end these diseases. Specifically, the advisory council would be comprised of representatives from the relevant federal departments and agencies that have a hand in Parkinson's disease research, care, and prevention, including the National Institutes of Health, the Food and Drug Administration, CMS, the Center for Medicare and Medicaid Services, the Department of Veterans Affairs, the Environmental Protection Agency, amongst others. The council also includes representatives from the Parkinson's community, including people living with these diseases, their care partners, researchers, clinicians, and other experts. Now, you may be asking yourself, okay, so why do we need a council to help Congress? That seems like something that could already be done. Also, if it's no cost, then how is it going to be useful? And these are really insightful questions. First, the work should absolutely be underway, but it's not. Typically, our government tends to operate in unnecessary silos, which can slow progress and lead to inefficiencies. But with a directive from Congress, i.e. the national plan, the federal departments and agencies would be required by law to complete this important work that needs to get done. Additionally, the primary reason that this legislation is no cost goes back to what I was saying earlier. It's this Congress in which we are working to get it passed. This legislation authorizes for this work to be completed in the years to come. We'll be advocating on behalf of federal funding to support the work of the Advisory Council and ensure that the recommendations for how to speed Parkinson's research, improve the lives of those living with the disease, and prevent folks from developing the disease are funded appropriately. I often tell congressional staff and their bosses that this legislation will help Congress learn from our nation's foremost experts about how they can join us in putting an end to Parkinson's disease through clear, concise, and concrete recommendations. And now, before I go into my next slide, which details the progress we've made this session, I want to stress that this is a model that's worked and is working for the Alzheimer's community. So the National Alzheimer's Project Act is the bill that this bill was modeled after. It was signed into law in January 2011. At that time, Parkinson's and Alzheimer's funding at the NIH for those diseases was $151 million and $448 million respectively. So they were both funded in the hundreds of millions of dollars. Since that bill has passed, the NIH funding for Alzheimer's disease research has skyrocketed. In fiscal year 2024, funding for Alzheimer's disease and related dementias at the NIH will be near $3.8 billion with a B dollars, whereas NIH funding for the Parkinson's will be over just half of what Alzheimer's received back in 2011. So the national plan is a central part of our strategy to deliver similar success for the Parkinson's community. Parkinson's is the fastest growing neurological disorder worldwide and is the second most common, only behind Alzheimer's. So our message to Congress is simple and it's clear. Now is the time to end Parkinson's. So I'm going to explain some of the progress we're making on Capitol Hill with respect to the national plan. This slide encompasses the latest information about the national plan from this congressional session. However, I want to acknowledge that the legislation was first introduced in the summer of 2022, but it did not pass before the end of the 117th Congress, which ended later that year. So for those who are unaware, Congress operates on 2-year cycles called sessions, And all of the bills that do not pass both chambers, so the House and the Senate, and are not signed into law by the president must be reintroduced in the next Congress to be considered. And it's essentially like starting the process all over again. However, in early 2023, we worked with our bill's lead sponsors, Representatives Bilirakis and Tonko, and Senators Capito and Murphy, to reintroduce the national plan and drive support for the bill, primarily through having other members of Congress co-sponsor the legislation. So other members of Congress will co-sponsor bills to demonstrate that they have their support, and by adding as many co-sponsors as possible from both sides of the aisle, we demonstrate that bills have broad bipartisan support, therefore giving credence for them to pass. For time's sake, I won't jump into what Congress considers a process of regular order, but it's suffice to say that each bill's path through both the House and Senate can look a little different. The main takeaway from this slide is that we've passed the House of Representatives with more than 400 members of Congress voting in favor of the bill. And now we're dead set on ensuring that the Senate passes the bill and that it's signed into law before the end of this session, which essentially lasts until the end of this year. I will also quickly note that as the legislation passed the House, it was renamed the Dr. Emmanuel Bilirakis and the Honorable Jennifer Wexton National Plan to End Parkinson's Act, in honor of Representative Bilirakis' brother, who passed recently, and Representative Wexton, who you may recall was diagnosed with Parkinson's disease and then PSP. She's been very public with her diagnosis, and I cannot stress enough about how much of a champion she has been for our communities. On this slide, the numbers speak for themselves in the context of what it takes to get this legislation passed. You can see how many advocates we engaged and how many congressional meetings we led. To complement our direct lobbying efforts, so the work that the Foundation's other lobbyists and myself do, our Director of Advocacy engages a network of advocates like yourselves to mobilize them when and where they're needed most. This is important because, as I've mentioned, constituent stories are the most impactful way to influence lawmakers. We have about 8 months left to get the Senate to pass the bill, and we intend to get that done this year. Our ask for right now is for you to join us in requesting your senators to advance this legislation. And I cannot stress enough that this takes a team effort, and we have not made it this far without support of advocates like yourselves and folks at CurePSP and other allied organizations. And I want to say that your engagement is sincerely appreciated. Right now on CurePSP's website, Julie and Jessica have created advocacy resources that make it easy to take action to contact your U.S. senators. They have options for you to email them, call their offices, mail them, and connect with them on social media, and they've done it so you can do it quickly and easily. They make it very simple to share your story or your experiences with PSP, relate it to the urgency of passing the national plan, and sometimes even thank your senators for their current support of the bill. I want to know that I've thanked them quite a bit throughout my presentation, but I cannot stress enough for each of you how significant it is that they are leading CurePSP to become an even more impactful organization by jumping headfirst into federal policy advocacy. Again, I work with them through the Unified Parkinson's Advocacy Council, but they are truly doing the heavy lifting, the yeoman's work themselves, and they have been an incredible partner. I highly recommend you check out the resources on their website right now or shortly after this presentation. And on this slide, I've included some of the resources that the Fox Foundation has also pulled together to help you take action and learn about legislation as well. We have federal and state one-pagers and action alerts, which are ways you can send a message to your members of Congress with the click of a button. We also have tools and resources that help you pull together a concise way to share your personal story with congressional offices, as well as an Advocacy 101, which includes the tips and tricks you need to know as you begin this journey of advocating with us. The final resource I want to highlight on this slide is our advocate training sessions. These are led by Amy, our Director of Advocacy, who will either coach you in a one-on-one session or in a group session to help you prepare for your first congressional meeting with us. She helps answer your questions and give you details about your meeting, and then you join a meeting with me or another lobbyist at the Foundation to advocate for the support of your members of Congress specifically. So I've covered some of the information about the national plan and explained how CurePSP and the Fox Foundation have pulled together some resources to help you engage in advocacy, but you still may be wondering, what exactly do you want me to do? And I cover that on my next slide. So this answers that question, but how you answer the question can depend on how much time you're willing to lend. So if you have 5 minutes, such as right after this meeting, you can call the offices of your senators today and ask them to advance the national plan to end Parkinson's Act. You can share information or the link to send messages to members of Congress with your friends or loved ones, or you may simply post about the bill on social media. However, if you have more time, like a day, We can work together to schedule a meeting with the office of your senators, virtually or in person, to discuss why the national plan is important and how they can support passing the bill. You may also happen to know your senators or their kids, and we would love to learn more about your relationships with them, because relationships are everything in this business. And if you have weeks or months that you're willing to lend, let's collaborate on some other exciting ways to share information about this legislation and ensure that representatives and senators are elected who will champion the needs of people living with Parkinson's disease and PSP on Capitol Hill. So as a final note, I want to highlight a piece of legislation that is soon to be introduced by Representatives Wexton and Balasalle called the Healthy Brains Act. This legislation seeks to establish collaborative centers focused on advancing research into environmental risk for neurodegenerative diseases, including Alzheimer's, Parkinson's, PSP, ALS, and others. You may know that most Parkinson's disease cases cannot be attributed to genetic inheritance alone, which implicates environmental exposures as a major cause of disease risk and progression. CurePSP, the Fox Foundation, and other members of the Unified Parkinson's Advocacy Council will support advancing this legislation once it's introduced, so I just wanted to give y'all a heads up. CurePSP has also been working with Representative Wexton to organize a congressional briefing later this month, during which this bill will be featured or highlighted, and the representative will highlight a congressional resolution she will introduce to designate May 2024 as PSP Awareness Month. Unfortunately, this briefing will only be open for congressional staff, but it demonstrates how CurePSP is working diligently with congressional champions to raise awareness and drive congressional support for the PSP community. And with that, I will conclude my presentation and turn the time back over to Courtney. Thank you so much for listening.
Great. Thank you so much, Mason. That was incredible. Next up, we're going to have Julie Balasalle. Julie is a social worker with a specialization in legislative lobbying. She's laughing because I was trying so hard to say her last name right that I just went straight to that. Thanks, Julie. Yes, like I was saying, she's a social worker with a specialization in legislative lobbying. She's an advocacy consultant with us at CurePSP, and her work is driven by honoring her mother, who had degeneration. She is passionate about educating and empowering the CurePSP community to participate in legislative advocacy. I'm so sorry, folks. That really threw me off. Julie, I'm going to give it to you to take it away.
Thanks, Courtney. Thank you. Hi, everybody. My name is Julie, and I just want to first thank you so much for being here today. Also really happy to see in the chat people are connecting, which is great. And so I'm here to talk to you about specifically what CurePSP is doing around advocacy. And first, I just want to start off again by saying, so as Courtney mentioned, my mother had a probable diagnosis of corticobasal degeneration. And I put that on my little slide here because it's an important reason. I'm the daughter of Mary Ellen. It's an important reason why I do the work that I do with CurePSP. I felt really sort of hopeless and powerless when I watched my mom go through her disease process. And I'm not a nurse, I'm not a doctor, but I know a little bit about advocating. So that's, basically one of the reasons why I got involved. And so my mom is my why. And that's an important thing to remember when we talk about advocacy, is always going back to the why we're doing what we're doing. So I'm really happy to be here with you today, and I'm really excited to talk about what CurePSP has been doing in, I'd say, probably the past year, but really we've really ramped it up in the past couple months. So Mason talked a lot about the Michael J. Fox Foundation and sort of all of their incredible resources, and they've been a great partner with us as we develop our own advocacy arm at CurePSP. And so one of the things that we've done is, as Mason talked about, we created our own letter that people can edit and send to their elected officials to support the National Plan to End Parkinson's Act. And we've had 700 members of our community send 2,037 letters to their members of Congress in support of the act. And that's a great number considering that we have just started this kind of work. And you can see here, I know that this map is small, but this is what's called a heat map. And it's basically showing where we've had the most responses from people sending letters. So this is a really great sort of representation of our baseline of where we're starting in terms of engaging with the people in our community like you all to increase our advocacy efforts. So that's just I think sort of a good representation of where we're starting. And so the other things that we've started to do is have some virtual meetings. So as Mason was talking about sort of training people to meet with their congressional members, we've had 4 virtual meetings with congressional staff. And actually, I think Wanda is here. She actually, I think, was met with the Michael J. Fox Foundation and also represented CurePSP in talking with her senator and also Jan in Vermont. Thank you, Jan. So we've had some really great meetings to sort of start our process in creating a network of advocates. I'm going to talk about that in a little bit. But we've also started presenting to support groups, so virtual support groups to talk about specifically how this impacts the PSP, MSA, and CBD communities. And we've also, as Mason said, been working really closely with the Michael J. Fox Foundation, specifically around this legislative initiative, the National Plan to End Parkinson's Act. But we know that we're going to continue to work with them. And as part of UPAC, we'll be able to coordinate with other organizations to make sure that we're all aligned and sort of understanding what needs to happen to make some changes. And so what's next for CurePSP? So there's a lot, and it makes me so excited to think about all the things that we are starting to put into motion to increase CurePSP's legislative and grassroots advocacy. So one of the biggest things that we're working on is a community survey that you'll be getting from CurePSP, hopefully by this month, that will focus around our pillars. So care, consciousness, and cure. And what we want to ask the community is basically, what should our legislative priorities be? And we give you like a survey. You can rank things. You can also tell us if something's not on the survey. It's really important that our advocacy comes from you, our community. So it's not, it's addressing the concerns that you see as the most important. So we're really excited about that. And we're also creating more resources for you. And so basically trying to increase our library of templates and things like that can help you, sort of like the toolkits that Mason showed us, and also be able to have a training essentially that you'd be able to sort of start to build your own capacity around advocacy. We have these toolkits now. One is live, so it's the one that Mason referred to, the National Plan to End Parkinson's Act. We're creating one for the Healthy Brains Act that Mason just mentioned. And really, it's just sort of a one-stop shop to learn more about the bills, to be able to send letters to your elected officials, to contact us about getting more involved, and really just trying to expand our impact by creating as many opportunities for you as sort of Mason mentioned, as your time allows. So if you go to psp.org/NP EPA, you'll see our toolkit there. And then if you go to the I Want to Learn section of the CurePSP website, there's a section that says Become an Advocate, and that will lead you there as well. So we're really excited about that, sort of very much on the horizon. And then thinking sort of more broadly and more long-term, we're thinking really strategically about how we can track legislation that's related to PSP, MSA, and CBD on the national and state level. So we know that there's lots of really interesting things happening on multiple levels of government. And so we're thinking about how we can use our advocacy network to be able to sort of keep track of those things and be able to communicate best practices across the community. And so that's something we're really excited about, and also expanding coalition partnerships. So being on the same page as people in our community and other organizations to be able to make sure that we're really harnessing as much of that collective advocacy as we can. And then sort of what I mentioned before is the creation of a national CurePSP advocacy network. So really trying to formalize our advocate training and really kind of create a hub and sort of a network of people that are ready and willing to advocate and are continually involved in our advocacy work. So that's another really, I think, exciting, new, potentially great project that CurePSP is working on right now. And also, I wanted to end on this note. So we think a lot about the importance of advocacy. And as Mason mentioned, it can be a little daunting and sometimes disappointing because of just the nature of this process. And so this Margaret Mead quote, which I'm sure a lot of you have heard of, is never doubt that a small group of thoughtful, committed individuals can change the world. In fact, it's the only thing that ever has. So I try and keep that in mind when I'm thinking about the importance of the work that we're doing. And to lead back to my first slide, really go back to, I think a lot about my mom. That's sort of like my why I go back to doing this. So even when I feel a little bit defeated, I have to feel really grounded in that. So I wanted to name that for everyone in case I know that there has been a lot of animosity in our political sphere. So I wanted to name that for you all too. But thank you again very much for coming. And I will turn it back to Courtney.
Thanks, Julie. That was fantastic. And I really like that quote that you shared at the end. I think I'm going to go back and make sure to type that down in my notes later. I'm going to welcome Mason back up as well as we go into the Q&A portion. Great. All right. So I think a great question to Julie's point that she just made that we can start off with is how do we get politicians to pay attention to these issues? Mason and Julie, you both gave really actionable items. And I think the concern, at least for me, is how do we get them to care, I guess. It's kind of the point. Start with Mason.
Sure. Yeah, I think that's a really great question. It's one I ask myself often. It can be different depending on which congressional office you're talking to, what their values are, where they want to put their legislative work behind. I think one of the biggest things we stress with advocates is that we want to create an echo chamber. What they're hearing in Capitol Hill and what they're hearing back home in their districts or states has to be the same thing. We want them to hear about these priorities when they're talking with lobbyists like myself or advocates like yourselves when you're meeting with the congressional offices, either virtually or in person on Capitol Hill. And we also want them to hear it at their town halls, at their listening sessions, in the district, in the state. We want them to come home and see that newspaper saying, here's the latest and greatest on what's happening in the PSP research and why we need our member of Congress to take action. So I think creating that sort of echo chamber between what happens on Capitol Hill and back home is a great baseline. Beyond that, I would definitely say it's relationship building, making sure you have a connection with the staff and or the member of Congress themselves. A lot of this work is about getting people to value and see the value in what you're putting before them and to take action on those issues. I think when we're talking about Parkinson's disease and PSP, these are bipartisan priorities that do not have a political party. PSP and Parkinson's do not care what your political party was. So we stress that with members of Congress and lawmakers and stress the urgency of attacking these diseases now to make sure that we are having a future in which we've actually ended Parkinson's and PSP. So I think connecting with them in district and in Washington, D.C., but also making sure you're trying to establish a relationship with that person, they understand, they trust you, is really important as well. And it's something we're going to help you do as you join us in these efforts to lobby on behalf of bills. And Julie, if you have anything to add, you're welcome to.
Yeah, I think one of the main things too is that members of Congress are voting on, theoretically, voting on things on ranging from like fish and wildlife, like regulations to early education to PSP. And so it's impossible for them to know everything about everything. So they rely on people to come in and talk to them about these issues because they cannot be an expert at every single thing that's put in front of them. So I also think it's important to note that you know more about this than they do. And so getting them to care is really about communicating what your experience has been and having them understand the impact of it. And so there's thousands of bills that are filed every session, and being able to sort of flag this in whatever way makes sense for your life is probably the most important thing. That there's sort of, it's like the Swiss cheese effect. Like, there's multiple ways to get involved, and we need all of them. So it's definitely, it's not an easy thing, but as Mason said, it's a repetitive sort of pounding of the drum.
Yeah, those are great answers. Very inspiring. We do have a great question in the chat that I would like to read out, and it's, are there government agencies or any bill initiatives that support or fund caregivers that cannot afford professional caregiver help?
So I would say I don't know them off the top of my head, but I will say that in the survey, I'm sure that there are, first of all. And then for the survey that we're sending out to our community, we have a caregiving section where people can indicate that that's something that they're really interested in us working on sort of legislatively. And also, there's like the National Caregiving Alliance. There's a lot of organizations that are doing really great work that I think would be great for us to work with, to learn more about their sort of legislative priorities and see where there's opportunities for us to partner with them. But I think that's a huge issue in our community. So thank you so much I think it was Jack. Thanks so much, Jack, for raising that. And I definitely, it's on my radar. I'm sure it's on CurePSP's as well.
Great. And I do want to point out before we go to the next question, Kathleen had asked, he gave a nice listing. Mason, did you want to add anything to that, or do you feel pretty set with that list?
No, that list is up to date. These are members of Congress who have co-sponsored the legislation specifically. I believe we've met with literally every single Senate office on behalf of this legislation. So if nothing else, they or their staffer should know about the bill. That being said, not every member of Congress co-sponsors pieces of legislation. Sometimes, due to their position in Congress, or if it's not their area of focus, members will abstain from co-sponsoring certain pieces of legislation. For example, when bills are introduced in Congress, they're referred to committees with jurisdiction over that bill. Oftentimes, the chairman and ranking member of those committees, because they have such an important and powerful position over those bills, do not necessarily co-sponsor. That being said, it's a pretty comprehensive list there. You can see we have over 40 Senate co-sponsors of the bill. We've not really run into too much opposition over this legislation specifically. But everything we can do to continue to remind members of Congress about this piece of legislation, continue to urge them to support the bill in whatever way they're able to, is going to be important. So even if your members of Congress are on that list as current supporters, definitely continue to reach out to them, remind them that this is a priority for the Parkinson's and PSP community. No advocacy is worthless. It's always going to help our cause, help move the bill forward, because we don't know the types of conversations, the number of conversations these members of Congress are having with each other day in and day out. And if they bring up, hey, I heard from another constituent about the National Plan to End Parkinson's Act. What's the status update there? How can I be helpful? That really goes a long way in moving the bill forward. It really greases the wheels. So I say take that list. These are people who have signed their names as co-sponsors, but also know that your member of Congress may be supportive of the legislation, albeit not signed on as a co-sponsor themselves, but it's always important to reach out to them. Oh, Courtney, you're on mute.
Thank you. That was helpful. I did just get a message from Jack's question about caregiving, and she let me know that there is the Credit for Caring Act. It was introduced just in January, and it would provide a federal tax credit of up to $5,000 for eligible working family caregivers. So thank you, Jessica, for that quick little work you just did. Moving on to another question. Nancy actually mentioned the VA, which makes me want to go to a question by the VA. And are there currently any efforts that either of you know of to make PSP and other atypicals presumptive diseases for VA beneficiaries, like how there is in Parkinson's?
This is actually a really insightful question, and it goes into how bills are written and why they're written. This is a conversation that Jessica and I have actually had on behalf of potential advocacy work on this issue specifically. So for those who don't know, oftentimes, whenever the VA acknowledges that service members have a service-related connection, they allow them to access then the Veterans Health Administration benefits. That being said, they tend to list these diseases by name rather than sort of broad categories, because they want to make sure they're helping the right people whenever they have these sort of environmental risk factors or service-related conditions or exposures. Oftentimes, when it comes to neurological conditions, specifically Parkinson's disease. Parkinson's disease is most often named, but these atypical Parkinsonisms that likely have similar underlying mechanisms or causes, environmental risk factors, aren't named within that legislation. And then folks who are diagnosed with those diseases specifically are then barred from accessing the same benefits that folks maybe with Parkinson's would have. And so this is an area where we're actually focused, CurePSP and the Fox Foundation, interested in doing some advocacy work on behalf of these presumptive conditions. That being said, it is a lift. It is something difficult for Congress to do at times, but we're going to do everything we can to make sure that we are advocating with Congress to treat these diseases as similar as he can, especially when it comes to likely exposures or service-related connections that clearly should encompass both Parkinson's and atypical Parkinsonisms.
Fantastic. Thanks for that.
So long story short, we're on it. We're thinking about this as well.
I love that. That's what we want to hear. Okay, I'm going to zoom out just a little bit with this next question. And Julie, I'd love you to start if you're okay with that. And it's, is there any congressional support to fund and advance research for PSP, CBD, and MSA going on?
So we have, not specifically like in a piece of legislation that we have right now, but I know that there's movement to have more specific funding targeted for PSP, CBD, and MSA. The sort of murkiness of it is that it sort of gets put in different buckets. And so part of what we want to do as sort of our legislative work is to really sort of increase the awareness among members of Congress about these specific diseases, and in turn be able to have more targeted funding that goes specifically to them. I think there are definitely, some, and I don't know what they are off the top of my head, but I know that there are earmarked funds, I think at NIH, specifically for them. I don't know how much they're taken advantage of, but that's part of some of the work that we need to do at CurePSP is get really clear on what there is versus what we think there should be, and then sort of create an action plan to address them. But I think the larger question, the larger answer, I should say, is whatever it isn't enough. So part of what we need to do is, like I said, sort of get a good grasp on that, and then be able to mobilize our community, you all, to be able to really make that a concerted effort of the organization to increase.
And if I could just add to that, I think that is in part of the focus of the National Plan in Parkinson's Act as well. These are synergistic sort of ideas. We're not talking about just Parkinson's disease when we talk about Parkinson's in the bill's title. We're encompassing these atypical Parkinsonisms as well. And so it's not just about how the federal government's going to coordinate and focus around what we consider traditional Parkinson's disease, but also these other diseases will be included, incorporated as part of that national plan. So to Julie's point, getting the sort of the lay of the land and setting up a framework for Congress to then better fund, be more thoughtful and intelligent in how they're funding or putting money behind different disease research is something the national plan is hoping to accomplish as well. We actually ran into a very similar situation with Parkinson's disease and dementia with Lewy bodies. So the Alzheimer's funding that I was talking about, $3.8 billion, significant part of that is also applied to what's considered dementia with Lewy bodies, which is sometimes called an atypical Parkinsonism. Presents in terms of the science, the biology, sort of similar to Parkinson's disease, albeit some of the symptoms are different. And that is another area where, maybe they're not squarely fit within just, national plan or Parkinson's research or simply just Alzheimer's disease. And so when we were thinking about how we legislate around putting funding behind what our outcomes are, ending these diseases as a whole, neurodegenerative diseases, we sometimes put ourselves in silos, if you will, with Alzheimer's research or Parkinson's research or Parkinsonisms. And so what we're trying to do is across the board, there was the phrase, the rising tide raises all boats. That's very similar to what we're trying to accomplish with Parkinson's disease research. And we're bringing along these communities with us because they're integral to the science, understanding how we impact these diseases, how we end them. Also very similar in terms of how we provide care for folks who are currently living with these diseases. Face very similar problems amongst patients with Parkinson's versus atypical Parkinsonisms, sometimes very different. And so we want to make sure we're meeting patients where they need to be met, making sure we're filling their needs through legislation and writing bills and passing legislation for funding in a way that, again, rises all of those boats at the same time.
Awesome, thank you. And we've talked a lot about national initiatives and efforts, and I'm kind of wondering if there's anything happening at state level that you guys, either of you can share, if either of you wants to go.
So I think specific to PSP, is that what you mean, Courtney? Or
yes, sorry, thank you.
So yes, I think there is stuff happening, which is super exciting. And there may be more things happening on the state level at some point, just because stuff isn't happening in other places. So I think part of what I really hope for CurePSP is for us to be able to start paying a little bit more attention to what's happening in states on the state level. It's really difficult just because there's 50, obviously, and they all operate very differently. But I know in Connecticut right now, there's state level advocacy happening around a Parkinsonian plan, I think, in Connecticut. That's, I think, similar in some ways to the national plan, Mason. I don't know if that's true or not.
I believe
true.
so,
yeah. I also know there's some movement happening in Florida. And that's only two things that were just brought to my attention, nothing that I actually researched. So I know that there's, I'm sure that there's more, and that's part of the exciting work that I think CurePSP is looking at, is sort of how can we replicate best practices across states. Also keeping in mind that each state has its own, sort of legislative ecosystem, and they are very different. And so what works in one state may not work in another state. But sort of trying to, again, sort of create this network of advocates that would start to pay attention to things happening on the federal level and the state level. But I know that there are people who are really interested in creating more state level reaction, I guess, instead of being, not reactive, proactive legislation. And I know that, in Virginia, they just passed a resolution around PSP for May to be PSP Awareness Month. And so I think things like that are important because it sort of, again, starts to raise that level of awareness, and create more of a conversation, which hasn't really happened, I think, in a lot of, I guess, jurisdictions. But again, that's not an exhaustive list at all. I'm not an expert on every state, but there's definitely things that are happening. And it's exciting to think about the possibilities of how we can sort of harness that and share it with our community.
Yeah, if I could add on to that, when we think about the difference between state and the federal government, if the federal government is walking, state governments are sprinting. They pass legislation much more quickly and much fewer sessions and much stricter timelines. So state governments are really important as incubators for policy that oftentimes makes its way up to the federal level. And so they're important to watch, important to understand what's going on, and important to take action and begin advocacy there as well. So our state team at the Fox Foundation has been focused on a number of different priorities, a lot of which overlap with PSP. Notably, we often advocate on behalf of funding for Parkinson's disease at the state level, and we tend to be inclusive of Parkinsonisms as we're advocating on behalf of that funding. I'll also add that we've been advocating on behalf of creating Parkinson's research registries, and this has actually been an area where we found a lot of wins on behalf of state governments, because it's about better understanding or characterizing the prevalence and incidence of Parkinson's disease and atypical Parkinsonisms in states. Once we understand, where the problem is, we can be better about how we actually go about addressing the problem. And part of that is good public health data, which is really hard to come by. And so an important aspect of the work that we're doing at the Fox Foundation, the research organization I work for, is focusing on better research, better understanding and characterizing of where in these states are people presenting with Parkinson's disease. It allows us to then better characterize, what might be their challenges with accessing types of care, or what might actually be one of the underlying reasons or the environmental exposures that led them to developing these diseases. So it's really exciting work that also is encompassing PSP as well. So we're working in tandem on a lot of these things. We are thinking about Parkinson's and Parkinsonisms as we are advancing those at the state level as well. And again, these are really important incubators of policy that then oftentimes make their way up to the federal level. So it's a really insightful question, whoever asked that one.
Awesome. That's fabulous. I'm going to ask you guys one last question before we kind of go into closing. I think both of you will have great points on this, and it is, how can community members maintain hope through the years-long advocacy process when waiting for change? Julie, do you want to go first?
Sure. I mean, I think it's not an easy thing. I don't have like a cure-all answer, other than I know what helps me, and that's to sort of, again, go back to my why, and know that sort of is at the heart of everything that I do. It's a process that can be incredibly time-consuming and can feel hopeless at certain times. But also it can also be extremely rewarding, and it can really create a sense of empowerment. And that's what I really hope that we can do at CurePSP, is to really empower our community to use their experience as a tool for advocacy. And I think that there's, let yourself feel your feelings, but also, sort of come back to your why at all times. And that can be, like I said, a very frustrating process, but it's also, whatever capacity you're at, whatever your capacity is, to be honest with yourself about it. I know people who've had to take steps away from advocacy because they just didn't want to deal with it anymore, and then come back when they feel ready. But I think it's more also too, in whatever way advocacy fits your life, at whatever stage or time you're in, is the most important thing. And I think if sending an electronic letter that you don't edit is the only thing that you can do at a certain point in time, then that's great. If attending, a meeting with your elected official staff is great. If joining a committee is what you're able to do with your time, then that's great. Like, it's whatever you do is better than whatever you are able to do is better than sort of trying to do all the things at once. So I don't know, Mason, I'm sure you have a more insightful answer, but to me, that's sort of what I personally do when I can start to feel burnt out, because it's a long process.
Yeah, I think this is a great question to end on as well. I mean, CurePSP, because hope matters. This is why we do this work. One thing I wanted to stress, you had some great insights there, Julie, in terms of making sure advocates are not burning themselves out and making sure that they are feeling those feelings, because legislative advocacy, I've done it for my entire career at this point. It's so frustrating. And it is the thing that keeps me up at night, because this isn't how, we want our country to work. We want to make sure our representatives are at least doing the basics and attacking these diseases in the ways that they should be. That being said, one of the things that I see most often in my congressional meetings and the communities that I engage with is connection with other folks who are living with PSP or living with Parkinson's disease. Finding your community of advocates is important. You're never going into these meetings alone, or typically you're not. You can always have me in your meeting with you, but also have other members of the community, your neighbors, your loved ones, other folks who are living with these diseases to join you in this fight. As you bring them into the fold, we have more and more advocates who are having more and more messages, more and more interactions with their members of Congress. So bring folks along with you. Don't feel like you have to go in this alone. And if you're ever looking for expertise or insights or the latest and greatest in terms of policy advocacy, you have organizations like CurePSP, like the Fox Foundation, who are willing to be your guide. But make sure that you are investing your time in a way that is for the long haul and brings folks along with you. I think that's an important part of advocacy that we sometimes overlook, because it's all about community, it's all about hope. But making sure that, when you have your best friend in a room with you and you're talking about what this member of Congress needs to do, it does make the meeting so much easier. It makes my meetings easier, I know, when I'm joined by advocates in this fight, as we're talking about, policy that members of Congress should be supporting. So definitely don't go in it alone, and make sure, as Julie mentioned, you're seizing the opportunities that are best fit for you, the ones that, aren't going to make you feel burnt out, but at the same time are doing something rather than doing nothing. As I mentioned early in my presentation, it's either you're at the table or you're on it. So let's make sure that we are at that table and make sure we're building the table such that CurePSP and Parkinson's disease are in. So thank you for that question. I love that.
Yeah, I love that you both ended so strongly on a note of hope. And with that, I just have some closing remarks. Julie and Mason, I want to thank you so much for filling us in on what's going on and how we can all get involved. I really appreciate it today.
Thank you for having me.
Awesome.
All right. Like I said, I just have a couple last housekeeping items. I briefly mentioned in the beginning of the webinar, and Julie and Mason also mentioned it, but it's CurePSP Awareness Month. We have many special items planned this month, and we'd love for you to get involved. You can check out our Month of Awareness website page and make sure you share educational Did You Know posts on Facebook and Instagram to educate other people as we post them throughout the month. And as I was mentioned multiple times, please head over to our website and use our toolkit to send quick emails to your senators. We would really love to reach 300 emails alone in May, and so we'd love your help with that. Let's work together to spread awareness of PSP, CBD, and MSA. And lastly, if we didn't get to your question, please feel free to email at info@curepsp.org, and we'll do our very best to get you an answer. Our next virtual program will be on July 16th on the topic of memory, thinking, and behavior. You can learn more and register at psp.org/events. And in September, we'll be your host. So be sure to check that out when registration opens up in July. As a reminder, you can check out all of this on YouTube and Facebook. We are only able to offer these webinars and all of our resources and programs because of your support of our mission. We hope to see you in July, and enjoy the rest of your day.